Good morning, everyone. I'm trying to slowly make it through my inbox, which is kind of overwhelming at this point. But I received a message asking what the implant process is after a failed root canal is removed. So the implant process usually takes about a year. First of all is the extraction of the tooth. And if you go to a biologic or a holistic dentist, they're going to do what's called curettage, which means that they're going to scrape out the ischemic or the diseased bone that's in the jawbone to make sure that when that extraction site heals, there's not a bubble of infection that's still left that causes an issue. So they're going to make sure that that's really cleaned out. Most biologic dentists will use ozone therapy to sterilize that area to make sure that there's no future infection there. And then you have to let that extraction site heal, which usually takes about 6 months. 6 months later, they can come back in and they can place the post, which is basically a screw in the jawbone. It sounds way worse than it is. Your jawbone doesn't have a lot of nerve endings, so it's really pretty painless to get the post put in. And then the bone has to solidify around the post so that you have a stable tooth. And an implant is the closest thing to a natural tooth that there is. Some people will offer titanium posts. I know I touched on zirconia. Zirconia is like a ceramic post almost. It's not exactly ceramic, but it's similar. And it has, for people that have MTHFR or they have heavy metal sensitivities, the zirconia post is better, in my opinion. I have one of each, but the zirconia has space requirements, so you may not have enough bone or space in that area for a zirconia implant. Once the post is placed, the bone takes about 4 to 6 months, depending on where it is in the mouth, for the bone to solidify around that post, and then you can have the crown placed, which is the actual tooth-looking structure that goes on top of the post. I do want to talk about the difference between CEREC crowns and PFM. So I'm probably going to do a part 2 right after this to talk about the difference in the two, because I do think it's very important for you guys to know.